Has got a lot of people speaking and concerned. The proposed national health insurance system will fail to provide free and quality health services to all South Africans. Now, this is according to a new report published by the Instutute of Race Relations last week. The report states that under the NHI, demand for health services is likely to double, whereas the supply of health professionals and health facilities is likely to shrink. Dr Anthea Jeffery, Head of Policy Research at IRR, is joining us in studio to talk a little bit more about this particular research that has been conducted. Good to have you in studio. Thanks for being our guest here on the program.
Thank you.
All right, now, what are some of the assumptions underpinning the NHI? What are we worrying about?
Well, the NHI is attempting to resolve two problems. That in the public healthcare sector, we have a great deal of demand. We don't have very high quality. That in the private healthcare sector, we have problems of affordability. But its plan is that you will then pool all the money that's currently available for public healthcare, and it assumes that we can take all the money that's currently going to private healthcare and put it all into a single fund, the National Health Fund, from which all health expenses will be met. Yeah. So that you will then have a solution, according to the government, for what it describes as the 1684 dichotomy. The government's belief is that only 16% of the population is able to access private medical care, whereas the remainder must use public health services.
Yeah.
In fact, very many more people do use private health care. They prefer to make out-of-pocket payments rather than rely on the failing health services, which, despite the efforts of many dedicated professionals, very often don't have the medicines that are required, have been shown to have often insufficient standards of hygiene and infection control, where there are problems with staff attitudes and rising cases of medical negligence. So people are preferring to go to the private sector instead.
Are you saying that figure of 1684 is incorrect?
Basically, yes, because the indicators are that it's between 28% and 33% in essence of people are relying on private sector healthcare now. And many more would rely on it if medical schemes were not so expensive.
Yeah, yeah.
And a key reason why they are so expensive is that the government's regulations have pushed up the costs for everybody. And the government has been unwilling to allow a low-cost medical scheme option. This was proposed by the Council for Medical Schemes last year. It would have taken effect in January this year. It would have allowed medical schemes with a basic premium of between 180 Rand to 240 Rand a month. And the government reportedly scotched it, put an end to it, because it said it would undermine the case for the NHI.
Yeah.
But to my mind, it would be the beginning of a much better solution to our problems of inadequate access to good quality healthcare.
All right, I want to put that on the side for a sec, because I do want to delve a little bit more into that just now. But when we look at this report, and basically what it's stipulating is it pretty much so saying it's going to raise people's hopes. People are going to think things are going to get better, and from what they're currently sitting in at the moment. But indeed, at the end of the day, or a little bit further down the line, we're actually going to see people's hopes dashed. And then this is really going to destroy a lot of promises that are being made. What makes you come to these conclusions? What do you think is going to happen after NHI is introduced?
Well, I think naturally when people are told that they have the right to free healthcare from any practitioner or facility, there will be a huge increase in demand. So we must have an equal increase in supply, or that demand cannot be met. But in fact, there will be very few of the public health facilities that will be able to take part in the NHI. A public health facility, like a private one, can only take part if it is certified by the Office of Health Standards Compliance as meeting certain basic norms and standards. And the last set of figures that have come out from the office indicate that around 16% and perhaps as low as 6% of public health facilities meet those basic norms and standards. The rest of them do not have sufficient medicines, do not have sufficient infection control, do not have sufficiently caring staff attitudes, and so on. So those 84% of health facilities probably would not be able to take part in the NHI at all. And on the private side, you've got something between 30,000 and 70,000 practices that would need to be inspected and certified by the office. But it has only 35 inspectors.
Yeah.
It can't begin to get through that vast number. So the great bulk of private facilities would also not qualify simply because they haven't been inspected and certified and accredited.
My concern already is at this point that you find, and this is on a very, a level of people that I know. 2 people recently, and this is within the same month, have been sort of tried to be taken to different private healthcare facilities. They're on medical aid, they're trying to get there, but they arrived at about 3 or 4 different hospitals and they have no capacity, their beds are full already, that they couldn't take them and they were turned away. And hence, this individual I'm talking about had to go home. Now, this is without an NHI, that private hospitals are not able to deal with this, the capacity of people that are already on a hospital plan or whichever way they're working. How are they possibly going to handle now with this overflow if NHI does come in?
It will be impossible for hospitals, for private hospitals and clinics to cope with the demand. And what will make it more difficult to them is also that the government will control every aspect of healthcare, including the prices, the fees that are payable to doctors or hospitals. And if you're a specialist working in a private hospital, you will get the same fee as if you were a specialist in a public hospital. But in the private sector, you have all sorts of overhead expenses that have to be met. If your fee isn't enough to cover those, then the chances are that you're going to close your practice. And the government may hope that those people will then move into the public sector, but they're in high demand right around the world. They might choose rather to move overseas, to emigrate. And then we have a smaller pool of health practitioners to meet this increasing demand.
All right, I'm going to press pause there for a sec. We're going to take a break and we'll continue this conversation when you return after this break. But we'd love to hear from you. What do you think of NHI? Do you think this is the way to go? Or perhaps do you think this is exactly what we've been hearing from Dr Anthea Jeffery, the fact that there is just going to be a deterioration in healthcare that South Africans do get due to this. But we did invite the Department of Health to participate in this conversation. Unfortunately, they didn't make it this morning and they weren't able to come. So we're hoping that in future they will be able to be with us so that we can get a little bit more clarity of what comes out of this particular interview. Do stay tuned to Morning Live.